This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is Dr. Deepak Megur, and I'm here with a case of a mature dense cataract, and I'm going to demonstrate a few pearls while doing lateral separation in these denser cataracts. So let's begin the case. She is an 75-year-old lady who has come for surgery, and as we can see, the cataract looks white now. So I'm sitting temporarily, make two side ports. The capsule is stained with trypan blue under the air bubble. The dye is washed off. A dispersive OVD is placed into the eye. The globe is stabilized, and a triplanar 2.8 mm limbal incision is being created. Since I'm using dispersive OVD, I'm reasonably assured of the chamber being maintained well. So I'm not planning to do any two-stage rhexis, and I don't find the capsule to be very tense. So my goal is to make around 5 mm rhexis. I'm assuming that the nucleus inside is not so dense. Now looking at the white colored cortex which is underlying, my assumption is that the underlying nucleus is not very dense. So my plan was to do just the ideal rhexis, and it should suffice to deal with the nucleus. That were my thoughts. The rhexis is done. It looks to be appropriately sized and centered. Time to phaco, and because it's a white mature cataract, I usually avoid hydrodissection, and I'm directly going in with my phacoemulsification. And as I'm clearing off the superficial epinucleus in the cortex, the actual color of the nucleus is laid bare now. So the overlying cortex was acting like a camouflage and hiding the true nature of the nucleus inside. So the nucleus now looks to be all red and brown and looks to be quite dense. So at this point, I've changed my plan from doing a direct chopped 4-quadrant technique, which is my go-to technique when I'm dealing with a slightly denser cataracts. So the settings are changed to the sculpt mode, and my left instrument is stabilizing the nucleus. And as my trenching begins, I'm going to use torsional energy to create the trench. The common mistake most beginners make is that while doing trenching, they tend to push at the nucleus. So you shouldn't do that. The trenching is to be done in such a way that the probe should move very gently and the nucleus material in front of it should just melt. So we are not going to use any physical force to create the trench or a groove. It is going to be the ultrasonic energy which is going to create that groove for us. By following this basic principle, we ensure that we don't put undue stress on the capsular bag and the zonules. So that is one of the basic principle which one need to follow, and this is the most common mistake most beginner surgeons do. The nucleus is rotated 90 degrees, and the subsequent groove is always going to be deeper than the previous groove. So I continue to deepen these 4 trenches. And at this point, when we have got sufficient depth, I look at the color and also the horizontal striations. Let me pause the video here for a second. Let me show you that the central portion of this trench is much more deeper than the distal end or the peripheral end. In the peripheral end, we can see few horizontal striations, whereas the central groove, we cannot see any of this, suggesting that this is at a much deeper plane. And we always should aim at having the deepest trench in the central portion, and the peripheral parts of the trench should be narrower. This is simply in accordance with the lens anatomy, which is biconvex structure. So we need to be mindful of this. At this stage, I have decided that this much depth is good enough for me. So now is the time to perform the lateral separation maneuvers. So in this case, I've done a modification. Instead of using the passive lateral separation maneuvers, I'm going to use a modified chop variant, wherein I'm going to bury the phaco tip into this fragment, pull it up a little bit, just stabilize it, as my left hand, which has the long chopper, goes down vertically and then does the lateral separation maneuvers. By this, I am not going to exert any lateral stress on the capsular bag because of my right hand movement. The right hand is gently holding the nucleus and pulling it up, whereas the left hand goes down. And as you can see, the chopper is placed right at the bottom. It is there at the last micron as well as the lateral separation maneuver is being done. This ensures the lateral separation maneuver goes off in a very smooth and unforced way. So the important point here is to have an adequate depth, that is 90% groove, and then the positioning of the second instrument, that is a chopper or a dialer, which has to be essentially be long so that we can have a good reach, and that should just do the lateral separation maneuvers. And usually you require more than a couple of maneuvers to break the posterior plate completely in each of the quadrants. So now we have got 4 distinct pieces which are quite large, but that's what we're going to manage now. So because there is a lack of space, maneuvering the first fragment out of the bag is going to be slightly tricky, but nevertheless you get a hold of it and then pull it out. And then I'm going to emulsify it at the level of the rhexis margin. So again, the settings are changed here now to the torsional mode, that is the quadrant removal mode, where we want good cutting efficiency. So I shift it to the torsional mode and the hard cataract is emulsified very easily. So in this modern technology and machines, the harder nucleus is not really a challenge, because we really have enough power for us to safely emulsify the nucleus without causing any wound burn. So each of these fragments is now being consumed. Time to replenish OVD into the eye to safeguard the endothelium, and the remaining fragments are emulsified in a step-by-step manner. The bag is empty, there's hardly any epinucleus. Few strands of cortex are there which are flushed with PSS and then aspirated with bimanual cannula. The bag is filled with OVD and the planned single-pieced intraocular lens is placed into the bag. The OVD in front and behind the lens is gently irrigated out of the chamber. The ports are hydrated, and that's it, the case is done. To summarize, most beginner surgeons are frightened to deal with denser cataracts for the simple reason that most complications like posterior capsular tear, zonular dehiscence, or rhexis tear all happen during nucleus division techniques. So try to find the most safest way to break the nucleus. So with the advantage of the torsional energy, I have reverted back from chop techniques to the sculpt techniques for dealing with the harder nucleus. So once you've created a 90% depth, the amount of energy or force required to manually separate these fragments is very lessened now. So the trick here is to always keep the second instrument, at the chopper or your Sinskey hook, way back at the level of the posterior plate itself. So for that, we need to see well, focus the microscope very well on the posterior plate, and then place the chopper or the long Sinskey hook right at the posterior plate, and just a couple of lateral separation maneuvers ensures a complete crack. So one thing is to understand the principles right, so that you need to get the maneuvers right. So always, don't use excessive manual force to separate. It's not worth it. It's going to get us into a lot of trouble. So try to be as deep as possible with the groove, and then ensure that your second instrument, which has to be slightly longer, so that we can have a good reach up to the posterior plate, and then simple lateral separation maneuvers with the instrument being placed at the right plane ensures that the nucleus division maneuver becomes a very safe and a simple process. So that was it. Thank you for watching and hope you found this helpful.